on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. Hello, South Florida and beyond, and welcome to the How to Stay Healthy show. We've got a great show tonight. We're going to be talking a lot about endocrinology, endocrine diseases, thyroid, diabetes, osteoporosis, everything that endocrinology is about. So before I start, I just want to say thank you again to All County Healthcare. And if you have any questions about Medicare or home health, they're a Medicare certified agency. You can call All County Healthcare at 1-888-717-7170. And we're actually on their Facebook page, Facebook Live. So I'm going to do that right now. And if you have any questions, you can, for the doctor that we have on tonight, you can ask from right there. So that's great. And all the radio shows are on allcountyhealthcare.com. So thank you for the sponsorship. Tonight we have Dr. Ikna Krysiak. She's an endocrinologist at Tenet Florida Physician Services in Fort Lauderdale and on staff at Florida Medical Center at campus in North Shore. Dr. Krysiak, welcome to the program. How are you doing tonight?
Thank you. I'm doing great.
And thank you for joining us on this adventure of health. Endocrinology, until a few years ago, to be honest with you, I didn't even know what it was. I mean, it is something that I've learned so much about in the last few years. So I got an endocrinologist on the program tonight. So what is endocrinology?
So it's funny, actually, a lot of times people don't even know when they come see me that they're seeing an endocrinologist. They're not that familiar with the word. We often have to say diabetes specialist or thyroid specialist, but basically an endocrinologist or an endocrine doctor is the doctor who takes care of hormones or glands that control different types of hormones. I think probably the most common diseases we see are diabetes and thyroid, but we see all kinds of disorders that involve hormones like PCOS, pituitary gland, adrenal gland, many different things. So endocrinology is a very broad field or subspecialty of internal medicine.
It sure is, and thank you for explaining that subspecialty in internal medicine. We've had a lot of internists on this program, so the listeners and viewers will recognize that term. But I really wanted to have you on for a while now because I have so much to ask about endocrinology. It's something that I find myself searching every day because the areas of interest that endocrinologists treat is growing. One of the questions I wanted to ask you about is thyroid, because thyroid is January is Thyroid Awareness Month, and I actually didn't ever think of much of the thyroid until a few years ago when my mom had some thyroid issues. So I've learned a lot since then. But I know the thyroid is located in the neck area, but tell us a little bit about the thyroid and where exactly it's located.
Sure. So the thyroid gland is a butterfly-like shaped gland right here at the base of our necks. It's actually a very important gland. Many people don't know where it is or that they even have one, but it produces a hormone called thyroid hormone that is involved in functions of pretty much every part of the body. It can affect the heart and the heart rate. It can affect blood pressure, your metabolism, how fast you digest your food, sleep. It just affects so many things, and it's actually necessary to live. So it's a very, very important gland.
And one of the things I wanted to ask you about also is thyroid disease. Is that the same thing as thyroid cancer when we hear thyroid cancer?
No, so thyroid disease is very broad. It means any possible abnormality or, something wrong with the thyroid. And actually, the majority of the time, it means that someone is not making enough thyroid hormone, such as hypothyroidism, or you're making too much thyroid hormone, like hyperthyroidism. But a small subset of thyroid disease is thyroid cancer, which is an actual cancer or malignancy involving the thyroid gland.
Now, is that something that the endocrinologist would diagnose, or is it a primary care physician sends the patient to an endocrinologist and then the endocrinologist diagnoses the thyroid?
That's a good question. We find thyroid nodules, which are like little lumps or circular masses in the thyroid, very commonly now. And part of the reason we find these so much now are because we do so much imaging for so many different reasons that a lot of times it's incidental. So it could be anybody who could find it, but majority of the time it's the primary care doctor who's doing a general exam and feels it in the neck, or they did a test for some other reason and they found these little nodules, and so often they'll forward them or refer them to us so that we can evaluate further if needed.
Okay, I was always wondering, because you don't see a lot of people that wake up and they kind of like, I need to go see my I need to go see my endocrinologist. You know, that maybe they haven't been to an endocrinologist before. You know, they don't just wake up. It's something that a lot actually patients are referred to by primary care.
Usually, yes.
You don't have a lot of walk-ins who have you never seen before and saying, I need to see an.
You know, now that there's insurances that people can go to without a referral, we do have some.
Okay.
But majority of the time, they've been diagnosed already by someone, and usually that's that primary care doctor. Though a lot of people read a lot online and, you know, see things that they feel that they might have, and so they're like, well, this is the specialist that usually takes care of it, so sometimes they'll skip the primary care doctor and see us. But usually, yes, it's referred by the primary care doctor.
And those thyroid biopsies, is that something that you do right in the office?
I do. I do in the office. So there's special criteria. Not everybody needs a biopsy. It depends on your family history. Do you have a risk factor for it? You know, have you had radiation in the past? But most importantly, the characteristics or what it looks like on that ultrasound. So certain size criteria, or if it looks funny and it doesn't look like it should, then we biopsy it. And if it meets that criteria, we set up an appointment for the biopsy, and I do them myself. It's actually a very simple procedure. It's very, very similar to a blood draw. It's called FNA biopsy, which stands for fine needle aspiration, which means it's just a needle stick, basically. But we do it with an ultrasound so I can see the nodule exactly where I'm going. And again, it's a very simple, safe procedure we can do right in the office. The results come back about a week later.
Oh, that quickly?
Yep.
That's fantastic.
It is.
Now, what if you do see something? What's the next step in terms of treatment-wise?
Good question. So, if it depends on what we find on the biopsy, the majority of the times when we actually have to do something is when it's found to be either suspicious for, so it's not 100%, but it looks like it may be, or if it's definite thyroid cancer, the treatment is usually surgery. Majority of the time we send to someone who specializes in thyroid surgeries, and majority of the time it involves a very small incision where someone goes in, usually laparoscopically, meaning with a little camera, so it's a very small incision at the base of the neck, usually at the area where you bend your neck so it's not that visible, and the surgeon will take out the whole gland. Once in a while we can actually just remove half the gland, the side that had the mass, and then leave the other side in to see if we can keep that thyroid hormone being produced. But a lot of times actually the biopsies, in fact the majority of the time, the biopsies come back benign, meaning not cancer, and a lot of the times we can just monitor.
Mm-hmm. Now, when it has to be taken out, that you said that's a surgeon that would take it out laparoscopically?
Yes, it is not endocrinologist. It's often a question asked by patients. I do not do surgery. It is definitely done by a surgical specialist.
But you do the thyroid biopsy
But I
in the
do the
office
biopsy
before.
in the office, and I refer to the surgeons when I believe it's appropriate.
Okay, now another area of interest I saw on your website profile, I want to give that out. It's www.driknakrysiak.com. So Dr. Krysiak's last name is Krysiak. Or you can go to tfpsdocs.com and just search for Dr. Krysiak. You'll see a whole bunch of physicians there as well. But I saw another in your areas of interest, calcium disorders that's something that an endocrinologist can help with as well?
Absolutely. So it's usually controlled by a gland called the parathyroid gland. So a lot of people get confused, but it is not the thyroid. It is the parathyroid. Para means next to. So there are actually little glands next to the thyroid, again called the parathyroid glands. Usually there's 4 little ones, 2 on each side. And these glands make a hormone called the parathyroid hormone, which we often abbreviate to PTH. And this hormone controls calcium levels in our body. And our bodies want our calcium levels to be within a certain range. And so if it's low, then this hormone goes up. And if the levels are high, then the level goes down. But sometimes these glands go a little bit crazy on their own and start making too much or too little, usually too much. And again, sometimes if it's mild, we can just monitor. But oftentimes, to prevent complications, and that means when the parathyroid hormone is overproduced, it can actually cause the calcium levels to go too high. And when the calcium levels go too high, this can cause kidney stones. It can cause osteoporosis and weakening of the bones, and some other, just not feeling well, a lot of symptoms. But the serious things are kidney stones and osteoporosis. And so sometimes to fix it, it actually needs to be removed. Also sending to a surgeon. The good thing is we have 4 of them. So majority of the time it's one that's causing the problem, and we remove that one and the other 3 take over.
Is there a way to prevent calcium disorders and issues with the thyroid as well?
Unfortunately not. So the majority, especially in the U.S., of thyroid and parathyroid disorders are genetic tendency. They tend to run in family. Some of it is autoimmune, meaning that the body kind of attacks itself. We don't know exactly why that happens. It could have been a cold or a flu that you had as a kid or later on that made the body start attacking itself. There's a lot of different ideas on why it happens, but unfortunately, no. There's not a lot we can do. In olden days or in some other countries, sometimes there's not enough iodine in the diet. And so it used to be thought that iodine deficiency was a major deal, but really in the U.S., that's not as common. So unfortunately, it's not something that you can usually prevent.
I didn't know that. I mean, we're learning new things every day on the How to Stay Healthy show. We're here with Dr. Ikna Krysiak. She's an endocrinologist with Tenet Florida Physician Services, has an office located on the campus of Florida Medical Center in Fort Lauderdale. It was actually just a 30-minute drive from right here in the Boca Raton studio. Dr. Krysiak's office is 3001 Northwest 49th Avenue, Suite 104 in Fort Lauderdale. Like I said, she does rounds at Florida Medical Center, a campus in North Shore, great hospital. And her phone number is 954-714-0684. And Dr. Krysiak, you're bilingual in English and Spanish as well.
I am.
That's
I'm
fantastic.
actually Hispanic. So my last name is my husband's last name. But I was Espinosa, and I speak fluent Spanish because my parents forced me as a kid. And so it worked out in the end.
Yeah, well, that's a great thing to have, in South Florida as well.
Absolutely. It is great.
That's fantastic.
I appreciate it a lot. And the patients do too.
Yeah, definitely. So if you have any, questions about endocrinology or the thyroid or calcium disorders, definitely check out Dr. Krysiak and see if she can help you out. As we're on the thyroid topic, how does thyroid cancer develop in the body?
So there's a lot of controversy about causes of thyroid cancer, and actually the field that there might be growing, that we're having more of it in the population. It tends to be due to a genetic mutation. So again, not necessarily something that people can prevent. It does also have a genetic risk factor. It tends to run in families. But some risk factors besides, the genetic risk or the family risk is radiation. It used to be that kids, especially in dental procedures, were treated with radiation. That doesn't happen very much anymore. And incidents like Chernobyl and things like that, basically high dose radiation to the neck can increase that risk or cause normal cells to become abnormal. Usually not the case with your typical CAT scans and things like that. It has to be high dose, maybe someone who underwent chemo and radiation in the past for some other reason. But a lot of times it just pops up due to a mutation, and we find it incidentally.
Yeah, and genetically, like you said.
Genetic risk factors, absolutely.
Do you find it thyroid issues more often in men or women?
It's actually much more common in women.
In women, that's what I thought.
Yes. Unfortunately, when it is found in men, it tends to be a little bit more aggressive. So we become a little bit more aggressive. That information is controversial. It might just be that because sometimes men don't go to the doctor as often as they should, that when they find something, it's more serious because they went to the doctor. But it's definitely a more commonly found in women. I believe the statistics are 2.5 to 1. Women to men get diagnosed with thyroid disease.
That's what I thought. I'd heard that as well. Now, if someone isn't going to the doctor on a regular basis and not seeing a primary care physician or a physician like yourself, and they don't treat and have the thyroid issue treated, and they actually have an issue, that's a cancer that could spread to other organs in the body, or does it stay in the thyroid area?
Good question. So it is like any other cancer, and it can absolutely spread. Though, thankfully, thyroid cancer, and to start out with, there are different types of thyroid cancer. There are more aggressive types, but those are much more rare. The more common causes of thyroid cancer are actually very slow growing. And so when they are found, they tend to still be in the neck, if not still in the thyroid. But sometimes it spreads into the lymph nodes or little glands in the area of the thyroid. But the majority of the time, it has not spread to the rest of the body, but it absolutely can. But thankfully, the thyroid cancer does not grow aggressively, and prognosis is, or the chances of everything going well are very good for thyroid cancer.
Dr. Krysiak, hold that thought. We're going to take a quick break, and on the other side, talk to Dr. Krysiak about diabetes, polycystic ovary syndrome, and actually obesity and weight disorders on the How to Stay Healthy show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
How to stay healthy. It's a question asked by many people and answered by few. On How to Stay Healthy with David DePino, I'm going to bring you the latest in health news by interviewing top doctors from South Florida and around the world. Tune in on Fridays at 5:30 p.m. right here on WWNN Radio 95.3 FM and 1470 AM, the Health and Wealth Network, to hear the latest health treatments and my curveball question of the hobbies and passions in life doctors pursue when not providing medicine. And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. Welcome back. We're with Dr. Ikna Krysiak. She's an endocrinologist at Tenet Florida Physician Services and on staff at Florida Medical Center at campus in North Shore. Dr. Krysiak, I want to ask you about diabetes because it just seems to be always in the news, and obviously it's a growing topic with the health of America and the world as well. So how can an endocrinologist help with diabetes? So diabetes causes many things and many damage to many organs, and it's very, very important that it is treated. And unfortunately, it's a silent disease, meaning a lot of people don't know they have it until they go to a doctor and have it checked, or until it's gotten to the point where it actually has damaged organs. A lot of the times it hasn't done anything yet in the beginning, but the sugars are high. And so often it's found incidentally also when someone goes to their doctor. So that's why it's so important to go to your doctor regularly, your primary care doctor, and be checked. But sometimes people do have symptoms of increased urination, increased thirst, just not feeling funny, blurry vision. Some of these things they actually do feel in the beginning. And so then they go to their doctor, it gets found out. Primary care doctors can treat diabetes, but sometimes it gets very difficult to manage, especially because primary care doctors have so many things to take care of at once. And since we specialize in this, we can dedicate more time, and sometimes we have a lot more plethora or more options for management. So
A lot of times primary care doctors, especially in patients who are more difficult or require a lot more medications or need insulin, will send a patient to an endocrinologist. So how do we treat? There's different types of diabetes. There's the most common, which is type 2 diabetes, and that's the one that's the most prevalent, that's everywhere in the world, that's most commonly associated with weight gain or being overweight, though often it's also genetic as well. Certain, races and Hispanic race, for example, certain Asian populations, different races have a higher risk of it. So sometimes even not being overweight, you have this what's called insulin resistance, meaning the insulin doesn't work well. And we have a lot of options in pill form. We have options for medications that are not insulin but are injectable, but a lot of patients like it because it also helps with weight loss and with appetite control. And then, of course, there's insulin. And, a lot of people are very scared of insulin, but insulin works very, very well. In the old days, it was given and people were dying of their diabetes and it was blamed on the insulin, but the insulin is life-saving. Our bodies need it. And diabetics sometimes don't make it very well, and sometimes just in the beginning of the disease, when they first get found out, the pancreas just tired out. It's not making the insulin, and so we have to help it out a little bit. And a lot of times, if people start eating right, exercising, taking the other medications, they're able to come off the insulin. So, again, we have a lot of options for treatment, and it's very tailored to the patient.
And if diabetes isn't treated by a specialist, you mentioned that it could attack the organs. What organs would it attack, and how does that work? Like that it would just kind of, I guess, over time just ruin the health of someone?
Basically damages organs.
Okay.
So high glucose readings or high sugar readings in the blood are basically like a poison. Our body wants our sugars very specifically, usually between the 60 to 100 range fasting, and then it goes up to maybe 120, 140 after meals. Anytime those numbers are going too high, it damages organs. The most commonly affected organs are the eyes. So people can actually, little by little, have vision problems and even end up with blindness from diabetes. It's actually one of the most common causes of blindness is diabetes.
I know that.
Absolutely. So unfortunately, it can damage to the point of blindness, which is why it's also very important for diabetics to go to their eye doctor at least once a year to be evaluated for that, to see if they can help with the treatment, if anything that is damaged already can be fixed. A lot of times some of it is reversible with treatment for the diabetes, but that's one organ. Another one is the kidneys. That's another one that's very, very, very common cause of kidney damage. Often also reversible or corrected if caught first or early. But it can end up even on dialysis, which is what a lot of people are scared of. And thankfully, because of the fear of the concern of these complications, they start taking care of their diabetes, and then they would never get the damage. So you can absolutely live your whole life without having any damage to any organs if you take care of yourself and you take your medications, you get your glucose readings correct. Another organ that is involved is the heart. So diabetics have sometimes 2 to 3 times higher risk of having a heart attack or a stroke, which is why as endocrinologists, even though we're taking care of the diabetes, we often also try to control the blood pressure and the heart, the cholesterol, to make sure that we protect that heart because the diabetes is so dangerous to it. It increases the risk of infections. A lot of times people end up in the hospital with an infection. Sometimes that's how they get diagnosed, or sometimes that happens when they're not taking their medication, unfortunately. And lastly, and of course there's many other organs, but lastly, another one that's also affected is the extremities, especially the lower extremities, the feet. Because
we've heard that term, diabetic foot.
Absolutely. Yeah. Absolutely. So you can get neuropathy first, which is basically damage to the nerves, which causes numbness, tingling, burning, pain. Eventually to the point where the damage is so bad you don't feel your foot. You might actually injure your foot, not even realize it. And then people end up in the hospital with, unfortunately losing toes, which is another reason why it's so important for patients to look at their feet every day, make sure that they haven't cut themselves, that they're cleaning their feet, and they're seeing their doctor or their foot doctor. But it eventually can lead, to what people are scared of, which is amputation. So diabetes can be very deadly if not taken care of, but thankfully we have a lot of options for treatment. And
endocrinologists like yourself who specialize in this. Thank you.
Yes.
Now, and I know firsthand, everyone knows on the show, my wife actually had gestational diabetes, so I got to see that firsthand. Does an endocrinologist help out with pregnant women and gestational diabetes?
Absolutely. So there are two main fields that take care of gestational diabetes. Sometimes it's maternal fetal medicine practice, which is more of like gynecological field.
That's
the
who we
OB
saw.
field. Yeah, so a lot of MFM doctors will see it, but often they're sent to the endocrinologist to manage it because we do manage diabetes. And especially in the patients who already had diabetes and pre-diabetes or type 1 diabetes beforehand, they require a lot more care. But gestational diabetes specifically refers to people who did not have diabetes before, and because of the hormones in pregnancy, developed it just during the pregnancy. And so it's a temporary condition that absolutely endocrinologists can take care of. Usually involves trying diet first if possible, and in some patients that is enough to watching the carbs and trying to exercise, but often does lead to insulin management, especially later on in the pregnancy, usually by the third trimester. Some people need insulin to help those sugars controlled. And part of the reason we do that is because it can lead to complications like babies being too big, problems with delivery, problems with the mom and blood pressure. So it is very important to be taken care of, and it does usually go away as soon as patients or moms deliver. But they are at higher risk for developing prediabetes, diabetes in the future. So it should be monitored at least by a primary care doctor after delivery.
Luckily, my wife's was diet controlled after a little bit of time, so kudos to her. It's hard to believe I asked so many questions that we're running out of time, but I'll have to have you on again because Dr. Krysiak also treats polycystic ovary syndrome, sex hormone disorders, obesity, weight disorders, osteoporosis, and other bone metallic disorders. You can check out her information, www.driknakrysiak.com, or call our office at 954-714-0684. Thank you so much for coming on the program.
It was
I really
my pleasure.
appreciate
Thank
all
you
the
for
info
having me.
on the How to Stay Healthy show. For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.
The opinions expressed